Yes, hello. This is Dr. Christian Wagner, and today I'm honored to have Dr. Lamberto Re having a discussion. He's calling in from Italy. Dr. Lamberto Re is a former professor of cellular and molecular pharmacology and the head of the Ozone Therapy Center in Camerano, Italy, which is on the eastern coast, close to Ancona. And he has an extensive curriculum vitae and several awards on the national and international arena. Dr. Ray is a former researcher in pharmacology at the Faculty of Medicine and Surgery and Sciences in Ancona. He graduated with honors in medicine and surgery at the same university in the summer session of 1983, but he has been publishing since 1974. He's the head of the electrophysiopharmacology section of the pharmacology laboratory of the University of Ancona. Since 1988, he has been a member of the Interdepartmental Inter-University Center, which was established between the universities of Siena and Ancona, where he participated in the study of biophysical and biochemical interactions between molecules and organisms. He has published a lot of papers, received many research contracts and awards, and attended countless presentations on various congresses around the world. Dr. Re is associated with the Italian Federation of Oxygen Ozone Therapy since 2003, and regarded by many, from what I'm reading, as the world expert on ozone therapy. So, Dr. Re, it's an honor to have you come on today to discuss with us a little bit about what you do. So first off, let me have you introduce yourself and maybe talk about a little bit about what got you interested in ozone. What is ozone? What are you offering in your clinic, and what kind of patients are you seeing, along with what clinical results do you have? And I think you mentioned you have a little bit of a PowerPoint presentation as well. So why don't you take us away?
Thank you, Dr. Boy. Thank you for inviting me. I am really very honored and very happy to share to all the people that is not really appreciate to this argument. Very difficult, because all over the world I can see sometimes very correct information regarding this kind of not therapy. I do prefer to call resource, but I would like to start again from the beginning. How I was interested to ozone therapy. So just I came from science, from pure science. I can see in your website a synapses. So my work was synapses. Very strange, but very beautiful connection between neurons, and where there is a transfer of information between receptors and the humoral. So it's very strange how could be possible to be interested in something that is absolutely different. Absolutely different. So at the beginning, I remember was 1993. So in that time, I was in a university doing research in neurophysiology and pharmacology, but I started to look for something different. You know, sometimes we know that with medicine, we can't reach, we go over our body. And my aspiration, what I aspire, is to help our body in healing himself, doing less damage of the illness itself. This was my target since from the beginning when I was younger. So when my hair became white, I started to change so I would like to share my experience, my knowledge in this new field. But how could be possible that I go inside so with this strong passion that so far I have after 30 years? So the first approach was one doctor in Italy who asked me, Lamberto, we know that there is some doctors doing ozone therapy. That this is a gas, ozone, very strange gas, and the unique gas is natural, but it forms only in particular situation where high energy came from lamp, from storm, or in the morning during the rising of the sun, UV. And this gas is a strong gas, So we can't understand how could be possible, and they asked me to go inside. In the same year, I had an approach with the professor of Cuba, Professor Olga Sonia Leon, and we cooperate with them with this laboratory of pharmacology in Cuba, in La Habana, just to study some medicine, some anti-ulcers, and acting on H2 receptors.
I'm sorry, you said
So
anti what?
H2 receptors, histaminergic receptors.
Okay.
This was the topic in that time with the La Habana University. And so you can imagine, in the same time, just 1 month later, the first approach, the same Olga Sonia asked me, "Hi, Lamberto, why don't try to look with your setup, experimental setup, what there is behind ozone?" I remained, so Olga, you are the second people now. I would like to understand more. But what is ozone? I never heard about ozone before, just only the whole of the ozone and the toxicity of ozone. Because if you go on the web, at that time, just if you can see on the web, only a pollutant, so the strong danger of ozone. So in my mind, I was thinking, how could be possible, Olga, that we can have some benefit by this gas? And she told me, "Hi, Lamberto, give a look. Ozone is an oxidant. So if you give an oxidant in small amount, you can induce a response, an antioxidant response, an adaptive response from our body." So this was only the first idea. And I was convinced that perhaps it works. But, I would like to know how it works. So my experience do not allow me to go inside one very difficult field like this because you can destroy yourself. So giving a look on the web, just only pollutant O3 is very strange. Now I can say to you also the molecule. This molecule is 3 atoms of oxygen. So normally oxygen in our planet is 2 atoms of oxygen. By a chemical point of view, are very, very stable. But sometimes when there is some interaction with the electricity, for example, we can transform O2, three molecules of O2 in 2 molecules of O3. But O3 is not so stable because we need a lot of energy to maintain 3 atoms together because they don't want to stay together. They want to be free. And after 10, 15 minutes, come back to oxygen. So this was the first thought. This could be a reason enough that we don't start to study one molecule because it's not stable in time, because this is a crucial argument. Because if this strange gas is so important for our life, why we don't study? Okay, we don't have money. Perhaps we don't have money back because it's not stable. We can't sell ozone in the pharmacy. You can't go on a pharmacy, please give me 1 kilogram, 1 gram of ozone. It's not possible. But I know myself. If something go inside my mind and start to convince about the mechanism, so I started to study a lot about ozone. What is ozone? Ozone is toxic gas, but everything is toxic in this planet. And coming back just only 1 century, not more, 1 century, at the beginning of the past century. So if at that time, but it's only philosophic, we can have a computer and look for ozone. Okay, at that time, at the beginning of the past century, we could find only good ozone. What is good ozone? Is the same ozone that we have after storm, or is the good ozone that we have in the morning when the sun rises and from the plant where oxygen come away, it transforms just for a few minutes. If we live in that place, we feel better. Just breathing only a small amount of this gas. But during the past century, during the industrialization, what occurs? That ozone increased, and the whole very far from our body was reduced, but was reduced because we put a lot of waste. So the problem is really the man. So we transform something good in something bad. Okay, but no problem. This does means that this molecule, it is not always toxic. But at very low concentration, could be possible that the first talk with Olga Sonia Leon could have something to be studied. And this, I started this joint venture with Ozone. Now I'm very happy after 30 years, because during my speech, I would like to talk why I am so happy now. Because at the beginning, okay, we know ozone, a small amount of ozone can induce an antioxidant response. But there is a biochemical pathway that can explain this. Now we know that there is. Now we know that a small amount of ozone, of any other oxidant, at low concentration, so at concentration that can't damage our body, can induce the activation, the upregulation of a metabolic pathway that is the NRF2 pathway. And in many papers, so I am a good doctor, I suppose, but I am a good scientist, because I read all the literature in this context. And 3 years ago, 4 years ago, I read a beautiful papers of one group, Quadrado, that starting to explain medicine in another way, just with an epigenetic mechanism, the possibility that our body, our DNA, can start to work properly if it is damaged from excess of oxidative stress. And this pathway, NRF2, is control about 1,000 of genes. And if you give a look to these 1,000 of genes, we can see a lot of strange things. For example, tissue remodeling. Tissue remodeling. So during my work in my clinic, now we have people from all over the world just to be treated with ozone, just because the skin is better. So what is the aging? Aging is oxidative stress. If NRF2 is able to reduce the damage of aging, sure, also your skin is better. But if we go deeply, I don't want to go over the question that you want to ask.
No, it's great. In fact, I was involved with hyperbaric oxygen for several years, and I know about the NRF2 system. We study genetics, the GPX, GSTP, SOD genes upregulation with hyperbaric oxygen, for example. But it's interesting to hear that you mentioned that NRF2 pathway, because it is so much involved in not only reducing inflammation, but also binding toxins, for example. But yeah, it's very interesting to hear. But no, keep on going.
Okay. So, but just I was even more impressed when in 2019, about 3 years ago, the Nobel Prize was given to Semenza, Ritcliffe, and another, I don't remember the name. The Nobel Prize in medicine, not in another, medicine. What they discovered, something that we know since the beginning of the life on this planet. We know our body need to work, they need to live with oxygen. So we born and we need to breathe oxygen, and we die because we breathe oxygen for all our life. And there is an homeostasis between. So they discovered the pathway in 2000, not in 2019, before, just in 20, 30 years before, but they were awarded with the Nobel Prize just because discovered the pathway that is HIF1 alpha. This is a protein, is a pathway, biochemical, that normally, if the level of oxygen in all our cells is normal, okay, this is destroyed by proteasomal systems. But if the oxygen drop down, this move to the DNA in one area of the DNA and starting the production of a protein that produce more erythrocyte, like we go in mountain, no? So, our body adapt and defend itself. But in the same time, so this is not the award with Nobel Prize, the NRF2 pathway was discovered later. So what we have in our mind? We have one body, and this body was done, I don't know what, but the engineer that produced this body, sure, you had to put some sensor that check to live properly.
Mm-hmm.
One is the level of oxygen, and the other one is how oxygen burn. The phosphorylation oxidative at mitochondrial level. We have antioxidant enzymes, superoxide dismutases, but sometimes they are low level.
Mm-hmm.
So, and this NRF2 that was studied many years ago is the pathway that control and check how oxygen burns, and if there is some problems in the antioxidant systems, they induce the upregulation of the genes that produce more superoxide dismutases catalysis. So this is only one aspect, because differently from H1 alpha F from the oxygen control, the NRF2 pathway controls one myriad, is a master regulator of all the possible damage related to age. What does it mean? That if you have one problem in the neuron, for example, in the neuron of the substantia nigra that produce dopamine, we age, so not all the people, luckily, but usually sometimes these neurons work not properly, so the production of dopamine is reduced, and we start to have Parkinson or other neurological disorders. So there are enzymes, there are genes that control this and can restart. We are not sure about this. These are only hypotheses, but based on the fact that NRF2 control all this situation that can worsen during aging. And in the same paper of Quadrado that was published, you can imagine, in pharmacological reviews. So the journal is Pharmacol Rev, impact factor about 2021, so very high impact factor. And I don't know if I have one slide about this, but it's fantastic because they conclude that this pathway control a series of illnesses related to aging, that is neurological, immunological, cardiovascular, along with cancer. So I don't want to say that ozone can help this. I want to say only that ozone. So probably I dump one step. We are talking about NRF2, but why we think that ozone could be? Because we know that the NRF2 pathway, NRF2 normally is bound to KIP1, that is a suppressor protein, and in this form is the same models of the other one that was received the Nobel Prize. It's the same. It's normally KIP1, and what in which way we can increase the NRF2 and move them to the DNA. There are three possibilities. One is pharmacological. If we use, for example, bartoxolone or methylfumarato, so the group of Quadrado is studying this kind of activator because it's Sure, it could be better because we could have money to do something better. But we know that the second one is the oxidative stress.
Mm-hmm.
So some oxidant or some other perturbation of this. So now we are sure, we demonstrated also, there is one paper that we published in 2014, and we demonstrated in humans that a small amount of ozone are able to increase, to upregulate NRF2. This paper was published in 2014 in European Journal of Pharmacology. And it is clear we use only a few patients because I was the sponsor of myself, so it's not possible to work with a large number. What I'm trying to do now, because we need now, we need to do more clinical studies, because what I say now give me the possibility to give an hope, just only hope. We know that ozone upregulate NRF2. We know that NRF2 can fix some problem inside our body, but I can't promise you nothing by a clinical point of view, because I need strong clinical studies or strong clinical evidence. I can see in my clinic, in the last 30 years, I treated more than 10,000 people. And I can see, for example, most of this situation. So in rare illnesses where we don't have any medicine, so at the end of this, we are talking about some promising attempts to do something in autism or many other pathological conditions where we medical doctor, pharmacologists, we don't have any medicine. Or, okay, we are trying our study to do this. This is the reason why we are ready now. We are ready to propose this resource, not therapy. I would like to change, because since the beginning, the founders, fathers of this ozone, in my opinion, they give to the platea, to other doctors, very complicated pattern and not deontological and ethical and scientific correct. Because some people told me, I give you ozone because I increase your oxygenation. It is different. Sure, when I give you ozone, I increase the delivery of oxygen to the tissues, but I don't increase the amount of oxygen, because the amount of oxygen is defined by our lung. When we breathe, we put oxygen in our hemoglobin, and if we have, for example, 80% of saturation, after the blood with oxygen go to the tissues, and to the tissue can deliver only 40, for example. If we have oxygen, the delivery of 50 or 60. So it's very different. Never tell that ozone increase oxygen in our body.
Yeah.
No. Understand what I mean?
It's a very good point that you bring up. You know, when I used to work in the hyperbaric oxygen world, you know, patients often ask me, how does it work? What is the benefit? And from what I understand, and correct me if I'm wrong, is that we are stressing out the body for the 1 hour that the patient is in the tube. It's a stressor to the gene saying, hey, there's too many superoxide forming. But because every cell in the body is exposed to it, every cell is responding genetically by upregulating to this. While, I mean, if you stay 6 hours or 10 hours in the oxygen chamber, you can be dead. But for the 1 hour, it's enough to tell the genes to upregulate with NRF2 to then, when you come out, the genes keep expressing themselves. And if you stack it one treatment after the other, eventually you 24 hours a day produce NRF activated antioxidant gene expression. And so I assume that ozone is doing the same thing. But let me ask you this. In your clinic, first of all, when did you establish your clinic? You know, what are the regulations on that? What are the concerns that you have legally or regulatory? And then what kind of patients do you see? And then, of course, what is the technique? What is the method of this? Is it, you
Okay,
inhale it? I'm assuming you're not inhaling it, but you're doing something with the blood probably. But could you walk us maybe through that a little bit? Talk about more about your clinic, what kind of patients are coming to see you, and go from there.
So there are two or three questions that you give me. The first is regulation. There are no regulation at all in any part of the body. When I was president of Italian Federation of Ozone Therapy, because we know that not only my clinic, but there are some clinic inside the hospital. Inside hospital, for example, in Naples and also in Careggi in Florence, we know that ozone, because ozone, the first use and the more scientifically approved use is for back pain. So, and there are this situation in which colleagues, very expert, very good colleagues, are working in this field, but no paper at all, no paper. I couldn't find no regulation. So is like it is tolerated, but not allowed. But what we need, what I would like for all my colleagues, there isn't a course in University of Ozone Resource of Ozone Treatment. There isn't. So if you want to give your culture, you have to study, or we need to give courses. And usually these courses are given from the people that sold the machine. Mm-hmm. Understand? This is a big problem because there is some conflict of interest. So I like ozone. I am in love with ozone, and I would like that ozone would be allowed because I studied 4 years ozone therapy. I use in my clinic the best, the good qualities. Good qualities does means that there is no rules, for example, about the generators. We have a lot of generators of ozone. So if you use ozone in medicine, you need to be absolutely you take care about this, because the ozone must be pure and the concentration must be controlled by a photometer. And one generator with a photometer built inside is very expensive. And there are no authority that check if I am using in my clinic. You can see in the board there, this is a machine with photometer. It's a very expensive machine. I have 2 of these. But nobody asked me or told me you had to use this for your work. Perhaps I could buy $1,000 machine elsewhere that works properly, but without photometer. So this strange, the lack of rules, of strong rules, probably help the bad diffusion that this treatment could not.
Can you explain what the photometer does? I'm assuming it measures the concentration of your generator.
So the photometer, yes, exactly. How we prepare ozone, or these generators prepare ozone. So we had to use a cylinder of medical oxygen. First of all, you can't use air, but medical oxygen. So this medical oxygen flow in a tube where it is applied electricity. So for example, I have one push, I push one button, 100 volt, another button, 1 atmosphere pressure. So the gas flow and the current transform one part of this gas in ozone. So at the end, we have oxygen and ozone. And at the end, before, when I put my syringe to take the mixture that is oxygen and ozone, there is a photometer just in the last part that give me exactly, doctors, you ask for 10 micrograms, okay, you have now 11 or 9 micrograms, exactly the concentration that I want. That is very important. Sometimes at the beginning I use my nose, because my nose is so, but we can't breathe ozone at very high concentration. low concentration. So this is very important. It's very important that because we produce our medicine. We don't go to the pharmacy, for example, for an ampoule of Voltaren and we give Voltaren. We are preparing our mixture before to inject to our patient. So we must be sure about this. So in my clinic, I use this kind of treatment. And you asked me, which kind of people?
Oh, wait, one second.
Yeah.
So what is your target percentage of ozone in your mix? You said there's oxygen and ozone. What is your target percentage that you
yes,
said?
Usually depending which kind of treatment.
Okay.
I want to say one thing. Some people, there is some mistake. Information is not correct. When we speak oxygen ozone therapy or oxygen ozone treatment, this is the first mistake, because oxygen is simply the carrier. Ozone is the medicine, is the active ingredient. It's like we put aspirin in water. So we put aspirin in water, but it's not water aspirin therapy. Yeah. This is very, very confusing things, because the amount of ozone is very low. So you imagine, the maximum amount that I use is 50 micrograms, 10 minus 6, or the less one is 5 micrograms. Why, you could ask me, this kind of difference? Because, as I told you, to induce this NRF, to avoid toxicity, we have to be always below the antioxidant capability of the tissues where we inject ozone. So if we inject ozone in the blood, the antioxidant capability of the blood is very high. Mm-hmm. So usually in this case, I use a concentration medium 40 micrograms per milliliters of ozone. That means if I take 100 milliliters of blood, I had to inject 100 milliliters of mixtures, 30 micrograms per milliliter, 30 micrograms ozone per milliliters of oxygen. That is the ratio. So
and how stable is the ozone? You said 15 minutes earlier, so you have to, I would assume, administer.
It's about, so at room temperature, without reacting to biological tissues, it is stable for 15 minutes, no more than 15, 20 minutes. Okay. So this is very important. Usually I use my generators near the patient bed. Every machine is near, so I produce. I don't want to wait 15 minutes to be sure that I have ozone. I want to give as soon as prepare the mixtures, also for other kind of needing, so to avoid any contamination. I don't know. This is so. The other question that you give me, which people? Most of the people is healthy people. I want to say to these people, ozone is to prevent, to help your body. Okay, I can give you also ozone for back pain if you want, or if you are stressed, or if you are headache, or if you want to increase your memory, or if you want to increase the delivery of oxygen in your tissue. So you want to run tomorrow, I give you this. But most of these people are healthy people. They want to maintain the body in good status. And that is, it works 100%, because we have, after 30 years, a lot of people. So this is not a scientific parameters. But if you have thousands of people coming to do this, that means that they feel better.
Now, I remember, for example, with the hyperbaric oxygen, it's not just that you can come and get one hyperbaric oxygen therapy and you're done. Is this something, how does your protocol look like? Let's say I have a patient with rheumatoid arthritis, a lot of free radicals, lots of inflammation. What would your protocol look like for the patient? And also, do you have any measurable benchmarks, how you benchmark? Do you do blood work before? Do you do after? Any surveillance? And then do you use any co-therapies like glutathione or anything like that that's associated with these genes or minerals?
Yes.
Have you found anything that works synergistically with it?
There are some works on you asked me one work in progress. So when you asked me before, what is the concentration that you use for people? This usually in medicine, always you have to personalize the concentration. So every patient, one patient is different from another patient. Not only, the same patients could have different response in base of, for example, they come to me after 1 week of rest, their total oxidative status is different from a week before, for example, where they had 1 week of hard works.
Mm-hmm.
So because the injection of ozone at low concentration to induce the upregulation of NRF2, it is a stimulus that we give, probably the response is not the same, always in the same patients. And this is what I am working on for the future. I have found some sponsor, and I would like to do one clinical studies, for example, in patients with arthritis, rheumatoid or other kind of problem, to check their status before and to exactly see the concentration, that the best concentration that can activate NRF2 pathway. That is what I am doing. But now I tell you, we have a lot of patients, but all over the world, we are treating patients empirically. And the observation, okay, I see you the first time, okay, you have arthritis, rheumatoid, I can check for all the blood tests and so on. And after I start with the medium concentration. The concentration is not too high, not too less. And give a look to the response of the patient. Not only the situation in the field of ozone is very in the ozone, the oxidative therapies is very complicated because their response can be different, not only because the level of oxidative status is different, but only, for example, if you have deficiency in selenium. Mm-hmm. So in your diet, for example, if there is deficiency in selenium, magnesium, cuprum, and other oligo elements, you know that superoxide dismutase does not work. Mm-hmm. So if you can give all the ozone that you want, you can increase the activation of superoxide dismutase, but if we don't have selenium, the response is delayed in time. Mm-hmm. That is, we have to take into account also this. And for example, okay, if the response is not good in that patient, please check this, and we go integration. Sometimes we do also integration with other antioxidants. But for example, in this case, when I use glutathione, for example, or vitamin C, there was a big debate before because some people told we can't use antioxidant using ozone. It is not, to my opinion, it is not true. Okay, it is correct, but I can give later, not before. I agree, because if I give one antioxidant before the treatment, sure, the body is modified. So I give before ozone and after other antioxidant, just to reach the best results. But for example, we know that other than superoxide dismutases, the NRF2 pathway activated by ozone can activate the nitric oxide synthetases. Nitric oxide synthetases is the basis for nitric oxide that is by the microcirculation in diabetes patients. Mm-hmm. But if that patient is deficiency in arginine, we have to give arginine. And arginine must be given before, not after. So we can talk. My experience usually is because I study. I am in lab. I suppose that you can see in my way to speak about ozone. Really, I want to put my experience as scientist, as pharmacologist, in neurophysiology, to give the possibility to other people to understand really the big potential, not more than the big potential. And you can imagine that.
So talk to me about the potential toxicity, because I like what you were describing with how to modify it to each patient. I do a lot of SNP analysis or genetics, so I do check the genes that are expressed by NRF2, such as GSTP, GPX, which is stimulated by selenium, the SOD
Yeah,
genes. So you could see based on the SNPs that this patient has inherited, where are the roadblocks, where are the genetic weaknesses, and so to possibly administer ozone. But if the patient is homozygous for GPX, to at the same time make sure you use selenium, for example. But
yeah,
um, with that being said, still, the question I have: how long do you usually recommend? Does it depend on the clinical response of the patient, or how often do they usually have to undergo therapy like this? And how often can you do it throughout the day? Do you do it once a day? And how does that mechanism work? Do you receive the ozone? Do you inject it then into the blood that you've taken from the patient and then re-inject it? And
yeah.
how does that work?
Yes. So there are several methods of administration. The most common, what I use now, the best is the ozonization of blood. So indirect ozonization, because some people, some medical doctor inject ozone directly. I do not agree just for, but one medical doctors can do everything. So the best way is to take one bottle, some thing that is resistant to the ozone, because ozone is very reactive.
Mhm.
So usually I take the blood and take the amount of blood that more or less is the body weight multiplied 2. So if your body weight is 80, I take about 150 blood. 150 blood I put in one glass bottle with sodium citrate, not heparin. I don't like heparin. I use sodium citrate just to maintain not coagulated the blood. I give ozone the same amount, the same volume of mixtures of ozone at the concentration, for example, of 30 micrograms. And after, when I collect and I put ozone, just in a few minutes, I inject again through the same vein. That is the best treatment, the safest treatment. All the circuit is completely closed, so nothing can go. You have to use some aseptic condition. And this is the best treatment for all the people. For all the people, usually I give in the last 10 years about 50,000 of this, 50,000. So without any problems at all, because if you use the good machine, the good concentration, and after, when I finish, when the bottle is empty, I change with the saline, and in this saline I can put some other things. For example, we need selenium, we need arginine, or we need arnica, we need some anti-inflammatory, some other things that won't help, because ozone really is something great, but I suppose that alone it is difficult that can reach some. I don't know. I want to give it to give some help to other colleagues, but sure, ozone could be helpful in any kind of discipline.
Sure.
And
So, I don't know what your experience is in regards to the variety of medical conditions. I'm very interested, as you know, in autism, and I know you mentioned autism. Uh, you don't have perhaps a lot of patients in this, but autism is just a word anyway. It doesn't mean anything. What I've found is, yeah, there's many papers that are written with autism being a condition of oxidative stress, neuroinflammation, cytokine elevations,
Claro.
and GI disorder, GI problems. And just in the most recent years, found that these children are affected with mold toxicity, probably because of genetic susceptibility. But we found mold toxins, and there's a researcher in Bulgaria, Dr. Markova, who published several papers even showing that there's kind of quiescent state of actual mold in the blood of these children, not just the toxins. And so that the mold transforms kind of holds its breath while it's traveling through the blood. It doesn't replicate, so that's why there's no sepsis. But that there are mold species in the blood. So the question, that I have was, could the ozone potentially be effective against these invaders? What do you see not only in chronic disease, but for example in bacterial or viral infections? What is your experience with COVID, for example?
So my experience, I treated also some patient that asked me, please give ozone to my son that is autism. But what we need, to my opinion, is this first step. You are one of the best doctors studying autism. I know nothing about autism, but I know very well the field of ozone therapy. So the cooperation between you and me could be, or any other couple of experts in the autism and in ozone, can give the best result. Why I say this? Okay, I know that, for example, in autism, there is some mistake, neuroinflammation. We know that ozone can reduce the inflammation. We know that that this oxidative stress, when going inside the body, is like a magic bullet. If there is something wrong in our mind, this can come back just with an epigenetic mechanism to come back to normal. I don't know. I have the evidence that it could be possible. But me, Lamberto Re, how can say to the parents of one autist baby, it is better or not? I have not your experience, understand? So in the future, I would like the auspices is that we could have this cooperation. For example, in this young baby, I use rectal insufflation. That rectal insufflation is, if applied in the good way, because it's like autohemotherapy, it's less effective, but like. And this, we did some protocols in relation to the age and to the gravity, to the severity of the problem. But I have only a few patients, not too much. This was a project that started in Brazil, but was stopped at the end because the problem is also the money. Who can give money to these people? If I told them you need more or less 60 sessions, 3 weeks, 3 times a week. So sometimes I give them free of charge, but and I am not sure. I am confident that I could have some benefit because, as I told you before, we can fix some neurological problems. And we don't know really, you know better than me that autism is very different. There are several classifications.
Yeah.
So I hope that this discussion now can open some interest just for the future. I'll be free. Christian, I tell you that I will be free when, if you want to cooperate, to stay in touch, and we can see how it could be.
Absolutely. I mean, what is very enlightening to me is immediately when you mentioned NRF2. So I wasn't aware of that, but and I only knew it from hyperbaric oxygen therapy. But I know also, for example, that resveratrol from grapes, from red wine,
Yes.
stimulates NRF2, or sulforaphanes also do. But ozone is very interesting because of the safety that you mentioned, and also because of that problem that I see with the mold in the blood. And I know that mold is, anaerobe and doesn't like that. Now, in regards to the chemistry of the ozone, does it follow the same pattern as, for example, what are the steps that the body does? Does it still require SOD and GPX to turn into water? Does it turn from the, O3 into superoxide, then hydrogen peroxide, then water? Or what is the metabolic fate of ozone?
Ozone immediately disappear when injected in our body, disappeared immediately. And there are second messengers. The first one is hydrogen peroxide, H2O2. Mm-hmm. That is the first one. And there are other molecules, but O3 O3 disappear. So sometimes I can see during autohemotherapy some doctors that after put ozone in the blood, they shake a little bit. Ozone in 5 microseconds, because the level of energy, the energy that we need to maintain 3 atoms together is very, very, very high. So when you have it room temperature, ozone in your syringe, I told you before about 15-20 minutes. But when ozone is inside any biological tissues or also in water, in saline, because I do not agree with people that use saline with ozone, because ozone is very reactive. So saline is 0.9% for sodium chloride. So sodium chloride, water, and ozone, you have sodium hypochlorite. So you don't have really ozone therapy. It's another things. And this is the reason why ozone, as soon as go, disappear. And the second messenger activate, because they are oxidants, no? Activate the NRF2 pathway in every cells of the body.
So you're using the blood that you're re-injecting kind of as a distributor of the ozone.
Yes. I sent to you my papers that I published in 2014, and that was fantastic because in the bottle we have only 120 milliliters of blood, and the level of NRF2 increased twice.
Mm-hmm.
After I recruited, I used 6 patients, 3 women and 3 male, and after, I don't know, there is some, and I asked them to stay 1 hour more in my clinic, and after 1 hour, I take the blood from another vein. So that means that in 1 hour, all the circulating blood, 5 liters, reach. So the amount of NRF2 was the same, double. That means that the information of this oxidative stress was spread to all the cells. That is
that is fascinating and very smart that you confirmed it that way. I know that hyperbaric oxygen, we know that at about 20 therapies, there is an about 800% increase in stem cells. Have you done
Yes.
any research in regards to,
No.
I think it was CD53 stem cells, which is a good benefit in stroke patients and tissue repair and things like that. But is there any evidence that you're aware of that ozone could stimulate the release of stem cells?
Yes, because ozone is regenerating. I have no specific work. I have only clinical evidence of what I did. And we can see, for example, if we have one ictus on one stroke, where there is, in the middle, the cells are died. And in the penumbra, there are cells that are deciding, oh, I want to go apoptosis or not, and the other one. So with this treatment, you can induce the stem cells and the cells active to increase and to regenerate the tissues. Sometimes it's incredible. You can see after MRI, but I have only some clinical observation, case report, not really studies. What we need is this.
Yeah.
And I am trying to do this now in the future. I have only 5 minutes, sorry.
That's great. Another question. How would you see any benefit of, for example, ozonizing water and then consuming it orally for gastrointestinal exposure?
Yeah. Yes. I suggest people sometimes, because usually the ozone resource now for me is suggested not as therapy, but as daily uses. No. You can come to my clinic, for example, every month or every 20 for all your life. It's like you ask me, doctors, I want to do some sport activity. For how long? For all your life. And this is the same for ozone. So sometimes in standing at home, they can use ozonated water, because ozonated water, fresh ozonated water, because in the water, depending on the temperature, the ozone decrease. So in the water do not react, so the molecule O3 remain O3 depending on the temperature. If you are near 0, you can tell 2 days, for example, or you had to use a machine. So in this case, you don't need a photometer, obviously, no?
Mhm.
Because if you want to drink, it is important that the water is saturated by ozone. So, and you drink, no problem. There are no effects in the blood or any other tissues. Or like breath, because the Food and Drug Administration start to say, that ozone is not useful because you can't breathe. But that is very
Yeah, it's
strange things, because you
hard
can
to
use some other way of administration, so no problem. But why we can't breathe ozone? Probably they don't know, but perhaps they know, because we don't have antioxidant at all in the alveolo. So also 1 ppm, 2 ppm is dangerous, but no problem. You close your mouth and you put ozone in the other place.
And so, probably not the greatest question, but when you mix it in water, should it be purified water or
Pure, better.
purified water? Okay.
Usually I use distilled water, but be distilled water is better.
Okay. Well, any other comments you have in closing? I know it was fascinating to listen to you, and obviously I could listen to you all day about this, but I'm very interested, especially for the autism community, to find out more how, if this could be an effective kind of adjuvant therapy in what we're doing. And yeah, probably we'll have you maybe back on in the future. That would be great. But thank you so much for all the great work that you're doing. I will definitely possibly refer some patients to you and where you are that I have in Europe. The patients looking for answers. But yeah, any other comments you have, Dr. Re?
No.
Any
I hope to see you soon, because I hope that this could be the beginning of a cooperation that I look for. And I don't know if Michigan is near Arizona.
Not really, no. What is in
I
Arizona?
in November I will be there. They invited me for a conference in Arizona, and I don't remember the city now. So I keep you informed if you want. So
What
I can
conference is
visit.
it? What conference is it?
Is in Ozone Ozone.
Maybe I fly over. It's not too far,
Okay.
not too long by plane. So
Okay. I
thank you
keep you
so much,
informed.
Dr. Ray, for all you do and for coming on and for sharing your knowledge. And we'll be in touch.
Thank you, Christian, doctor. Thank you. Bye
Thank
bye.
you very much.
Bye. Focus.